Patients with severe mental illness are spending days waiting for a bed in Queensland's largest hospital, with some left to sleep on the floor. Years of frustration over the state of mental health services at the Royal Brisbane and Women's Hospital has prompted a clinical nurse to come forward as a whistleblower to highlight how the system is failing Queensland's most vulnerable. State political reporter Rachel Rieger has this exclusive story.
Clinical nurse Nat Carmichael works in what's described as the coalface of mental health. The Psychiatric Emergency Centre is the first port of call for mentally unwell patients at the Royal Brisbane and Women's Hospital.
It's an area where we assess the patients who come in crisis to establish the best means of treatment for them.
After years of frustration, the 65-year-old is speaking out because he believes the hospital is failing.
I believe our patients deserve better. We have patients now who are waiting days on end before they're able to be admitted to the ward.
Mr Carmichael says in one case a woman was left waiting 8 days for an inpatient bed. With only 4 short-term beds, acutely unwell patients sleep where they can.
There's 3 people that are sleeping on the floor. They're sleeping on couches. They're sleeping where they shouldn't be. People deserve to have beds.
There are 87 mental health beds at the hospital, but because demand is so high, they're often full, which causes this backlog in the emergency department. The hospital has to scramble to find available beds, meaning often mentally unwell adults are placed in other hospital wards or with teenage mental health patients. In a statement, Metro North Hospital and Health Service says it understands it is not ideal for patients to have to wait for admission to a bed when demand is extremely high, and alternate bed arrangements may be made at times. Professor Brett Emerson knows the pressures well.
No, it's not acceptable. This is the result of the fact that there's been no increase in beds at the Royal Brisbane in the 25 years that I was the executive director there.
In response to this story, the Health Minister agreed to meet Mr Carmichael.
That is absolutely not acceptable. We have the biggest investment in mental health in the state's history with our mental health payroll levy, with a $1.6 billion investment. So there are more beds coming online.
Rachel Rieger, ABC News, Brisbane.